Experts say many rural EMS units are in a state of crisis right now. The WCPO9 I-Team has exposed some of those problems over in Dearborn County.
So now the county's trying to plan how to spend an additional $3 million in EMS funding. I-Team reporter Craig Cheatham spoke with EMS experts about some possible uses for that money.
Bright, Indiana fire and EMS paramedic Jacob King shows us his medicine pack.
Some cardiac drugs, some nausea medicines, then I have some fentanyl.
Medics can give prescription drugs and use tools that enter a patient's body.
I can actually establish access by drilling into someone's bone with this. This is an intraosseous needle, and this would go into someone's bone to give fluid or drugs.
EMTs, who are the most highly trained EMS responders in most of Dearborn County, can't do that. According to EMS officials, only Bright and Lawrenceburg EMS units have medics on staff.
It's an emergency, and you're 30-plus minutes away from a hospital, which makes it even more important.
This is Dearborn County 911.
911 records show medics rarely respond to large areas in the northwest and southwest parts of Dearborn County unless they arrive by medical helicopter. Those choppers can take longer than ambulances to reach patients and can cost patients tens of thousands of dollars.
I think it's unacceptable.
Studies show many rural EMS services nationwide, especially volunteer departments, have struggled with a lack of funding, fewer employees, and slower response times, something the I-Team repeatedly found in the Dearborn County town of Dillsboro.
It was scary because it seemed to take forever for anybody to get there.
In August, the Dearborn County Council approved a new local income tax increase that's expected to provide about $3 million earmarked for EMS services. King, other EMS employees, and outside experts told the I-Team they believe some of the new tax for EMS funds should be spent on hiring medics that would be closer to communities that don't have them.
The first question that needs to be answered is, what are we willing to pay for, and how much of it do we need?
Andy Gnap is the Deputy Executive Director of the National Association of State EMS Officials. He says Dearborn County should hire outside experts to examine the county's EMS services and come up with a countywide plan that uses the funding efficiently and effectively.
So if you're going to bring experts in and say, help us lead this, or help us design a plan, then you should be paying attention and actually doing what it is that those folks are telling you to do.
Dearborn County Commissioner Jim Thatcher says the county is researching outside consultants for that kind of work. The I-Team also found support for other ways to use that money. Sharonville Fire and EMS hired their own mechanic. Sharonville Fire Chief Dan Sunderman says that reduced out-of-service time for their emergency vehicles by 66%.
We can have all the firefighters we need, but if we don't have a vehicle to put on the road, obviously that's impactful.
Out-of-service ambulances have impacted EMS departments in Dearborn County. This year, Aurora EMS borrowed ambulances from Lawrenceburg and Ohio County, while one of their vehicles was unavailable and waiting for repairs. That left those other departments with one less ambulance. Could a local full-time EMS mechanic based in Dearborn County help those EMS departments the way it has Sharonville?
I think there would be huge benefit to that, if they were able to support that, financially.
EMS experts told the I-Team Dearborn County could also benefit by using some of the funds on community awareness, education, and training. They could buy defibrillators, then place them in higher traffic areas with public access so they can be used to save lives before EMS arrives.
That would be a solid win for a small community, because we know that those two things will save lives.
It's unclear how soon Dearborn County will begin a comprehensive review of EMS services and come up with a plan for how to spend the new money. Craig Cheatham, WCPO 9, I-Team.